The next exercise I'm going to show you is a 90-90 hamstring focused bridge. Now, to get into position, you are going to lie down on your back and you're going to place your heel on the chair like this. Now, from this position, if we are doing double leg, the goal is to push the heels down into the chair and pull them back. So basically you're doing this motion. But because the chair is there, there's no way for the legs to go. So you're going to push your heel down and then pull it together. When you do that, you would feel this part of your legs fire. Now, very important thing, if you notice that when you do these exercises, you feel cramping in your hamstring, it's crucial you stop right away. And not just with this exercise, with any exercise. When you feel a cramp, you stop right away. That's your body telling you that the muscle has been overworked and it needs to stop. You stop right away, let the cramping subside, and then you go in again. And this time, make sure you start with the intensity that your body's comfortable and build on that. And that's just a rule as a whole. So again, you're going to activate the core. That's the crucial thing. So here we go. Once my core is on, I check it and I make sure I can breathe in this position while I have the core, okay? Then I'm gonna place my hands by my side, dig my heels down and back, and I'm going to tilt my pelvis all the way back. So as you can see my pelvis tilting really back. So this is a 90-90 bridge with a spinal flexion. Normally we would want this in neutral position, but for this specific people with low back pain, this is what I want. So this will get the hamstrings on mainly as you dig back and down, and tilt your pelvis back. And you're going to hold this position up to 30 seconds. Once you get comfortable with this position, then I would want you to do this moving up and down. For the single leg version, obviously it's with one of the legs. Now, the situation is exactly the same. The leg that's not working, you're going to bring it into your chest. I don't want you to hold it. Just let it be. You can have it straightened, but I feel it's very uncomfortable. So just keep it where it is. Now, it's very important that you understand the foot that's on the chair. Usually I find my patients have their foot to the side or inwards. Make sure your toes are feeling up. Is facing up towards the ceiling. So mine is up, and sometimes I do see my patients, they crunch their toes like this to try to pull themselves up. Please do not do that. That will cause cramping of the foot or even the calves. Okay, so activate the core. Hands by my side. I'm digging my heels down and back, and I'm lifting my pelvis and I'm tilting my pelvis back as much as I possibly can so I can round the lower back. And then I'm going to hold this position for up to 30 seconds. Now, you will feel it in your hamstring and in your glutes. It's not an easy move, but it's a very, very fantastic move. Now, let's say you did 1 second. You can come down, rest, and do it again. Again, never force your body. It's very important that you never force your body to do something it is not ready to do. Whether it's cramping, whether it's tired, it's okay to stop. Allow the body to digest what just happened and then go in again. You don't have to even do it right there and then. You can give it 1 to 2 minutes. You can go have a nice cup of coffee, go for a walk to the other side. Either way, give the sides break, listen to your body, but don't push your body and don't get into the state of avoiding these motions. These are very, very important moves. They're highly potent, but they're very subtle at the same time. Once you build that 30 seconds, then these exercises can be progressed in many versions. And like I said, they all become dynamic at some point. And that is eventually the goal, okay? Anyways, I hope this helps. Any questions in the comments, and if I see you in the clinic, I will answer your questions either way. All right, bye.